To build your health, then you have to build your nutrition. Hi, I'm Dr. Joshua Derito, a family physician focused on public health and cancer prevention. Here, we turn complex sciences into simple steps that you can use today, because action is what makes a difference in your health. Let me show you something. A child wakes up in the morning and goes to school. Then he's hungry. A father in his 40s is diagnosed with diabetes. A mother collapses from a stroke at 52. Not because they didn't care, but because the system allowed them was unhealthy and made unhealthy choices the easiest. That is what public health is. And the environment that you live in has a lot of impact on what you do and how you live. Cheap processed foods available everywhere. Too much sugar everywhere. Too much salt everywhere. And we keep telling people, make better choices. How do you make better choices when the choices provided for you are not good? This is not just a personal choice. That is a systems problem. Nutrition is not about willpower. It is about what food is available, what food is affordable, what is advertised, and what people are taught. When unhealthy food is cheaper, when unhealthy food is faster, and the unhealthy food is everywhere, what choice do you have? Then diseases become predictable, because what you eat determines your health. Let's look at the evidence. The World Health Organization, the body that is responsible for making us healthy and helping us to keep healthy, identifies poor diet as one of the leading causes of death globally. The global burden of disease study found that poor diet causes more deaths than smoking. Yes, poor diet causes more deaths than smoking. What that means is that what people eat is one of the biggest drivers of disease on this earth. Another key concept. The Lancet Commission on Obesity, they described something called the obesogenic environment. Obesogenic environment. Environments that push people towards unhealthy food. Cheap junk food available everywhere. Aggressive marketing on every screen. Limited healthy options. People don't just choose food. They are shaped by environment. And the environment determines what you eat. So the real problem is what is happening in real life. In many communities, healthy foods are expensive. Healthy foods are not that readily available. Fast food is cheap. Busy life pushes the convenience. It is easy to make the sifted maize meal ugali than to make the whole meal ugali. You don't have time for that. It is easy to get a snack than to boil maize or make githeri. It takes a long time. So then what do you have? The easiest snack. So then we shouldn't blame the individual because the system has failed. So we need to think seriously. How do we make healthy food accessible, easily, and also build systems that make it easy to prepare it? Because if we are going to continue like this, we are going to pay and pay heavily. More people will have diabetes, more strokes in the 40s and 50s, more families losing parents too early, children becoming orphaned, more children growing up without guidance. The health system will become overwhelmed, treating disease instead of preventing it. That becomes the preoccupation of the health providers. We cannot and we should not sustain that. Imagine of this future. Healthy food is accessible. Children learn nutrition early and they learn to eat balanced whole meals. Families eat better together. Fewer hospital visits, lower cost, longer, healthier lives. This is possible. We just need to change our direction. What do we need to change? Think differently. Make better choices where possible at the individual level. Let's reduce sugar. Let's reduce processed food. Let's reduce the availability of the refined food in our homes. At the community level, let's teach our children to eat healthy in our schools. Let's have nutritional education, and not only education, but teach the children and help them make better choices by providing healthy meals. Then at the policy level, let's build better food systems. Let's regulate the easy access and availability of the harmful foods. Let's support healthy options for the families. When we fix the system, we fix the outcome. What is your role? You may not be able to control the whole system, but you can start where you are. Share this video with someone who might be having a difficult time making a decision about food. Choose better when possible. Choose whole meals. Teach and practice healthy eating as a family. Influence your community and your school to make better choices. If this video has changed the way you see food, then take one step today. Comment system if you believe nutrition is more than system, is more than personal. Share this video with someone whom you care about. If this message needs to reach more people, then share it so that we change the way we feed as a community, as a country. And if you want guidance on how to eat healthy, then we have a personal coaching program, the Health Inside 360 coaching program, or you can visit the Wellness Health Services for personalized nutritional guidance. Or you can call us or contact us from our website, or call or WhatsApp us with the numbers on the screen. I'm Dr. Joshua Derito. Let's stop treating diseases and start building health by what we eat. See you in the next video. Thank you for watching.